Sherwood from Brunswick Veterinary Hospital, and I'm here with Aaron to talk to you about canine cardiology. Aaron will have a few questions to ask, and we'll go over what we can to help you understand better canine cardiology.
Dr. Sherwood, how can cardiovascular conditions impact the health and well-being of my dog?
So largely quality of life limiting. So we're looking at a decrease in our willingness to go out for our walks, sometimes just a decrease in the distance that we can make it on our walks, all the way to severe respiratory distress that can be significantly life-limiting.
What is a veterinary cardiologist?
So a veterinary cardiologist is a board-certified specialist who focuses entirely on the health and well-being of the whole cardiovascular system. That's heart and circulating vessels.
What are some signs and symptoms of cardiovascular conditions in my dog?
So generally, exercise intolerance is our biggest one. It tends to be what we find the most common. Second to that would be coughing. Oftentimes a dog will present with a persistent cough lasting sometimes months, but usually we will hear that it's when they're quiet, when they're calm, when they're relaxed, basically when those airways are closed down a little bit and nice and relaxed.
How soon should I bring my dog in to see a veterinarian if I suspect a heart issue?
I generally recommend the sooner the better. Typically, heart conditions are slow growing, but there are a few occasions where it's a very quick progression, and the sooner we intervene, the better off we are.
How will a veterinarian diagnose cardiovascular disease in my dog?
So in dogs, typically we start with an x-ray. We'll start with listening to the chest, listening for a heart murmur, listening for difficulty breathing, any crackles or wheezes in those lungs. And then if we're suspicious, we'll progress to x-rays. We'll take a look and see, what do the lungs look like? Are they congested? Does the heart look like it's enlarged? We'll see various signs on x-ray to give us an idea of whether it's enlarged. We can actually measure it. And then if we find something that's concerning, we usually recommend an echocardiogram, which is an ultrasound of the heart. It gives us an opportunity to look at the internal structure of the heart, make sure that the valves are all one way still and not leaking any backflow into previous chambers, things like that.
What kinds of treatments are available for dogs with heart problems?
So typical treatment is medical. So we're looking at typically a trio of medications depending on how severe the cardiac disease is. If we happen to notice that it's early stage, not really causing much of a problem, we may just recommend monitoring. If it's starting to look like there's a problem that is going to need to be addressed medically, we'll usually start with a drug called pimobendan that is a pro-motility, to think about it, in the heart. It's basically helping the heart pump blood forward more efficiently. If we happen to notice that some of that fluid is backing up into the lungs, we may add a diuretic like Lasix, trying to reduce the fluid overall. And then if we happen to notice that there's any high blood pressure, we may prescribe something like an Allopril or amlodipine for that blood pressure to help the heart have a little bit less resistance to pump against.
What types of preventative care can help my dog avoid cardiovascular issues?
So first and foremost, the best thing that you can do for prevention is to visit your veterinarian. So before age 7 or so, we usually recommend once a year. There is no harm earlier than that doing every 6 months, but after that, certainly every 6-month physical exam. Make sure that we're listening to that chest, that we're getting an opportunity to have hands on your pet as often as we can so that we can catch that as early as possible. In terms of prevention at home, keeping a really close eye on how we're getting around and maintaining a good, well-balanced diet. We have actually noticed that some of the grain-free diets have been leading to some cardiac disease that we haven't seen in a long time.
That's all the questions for this session.
Thank you very much. And if you have any other questions, if anything else comes up, by all means, give us a call, let us know, and we'll help you out.